The next shock is the anaphylactic shock. Introduction. Anaphylactic shock is the sudden severe allergic reaction usually characterized by significant reductions of blood pressure. There is urticaria and bleeding complications usually caused by exposure to foreign substances after an introductory or sensitizing exposure. It is commonly known as anaphylactic reaction or anaphylaxis. Anaphylactic reaction is most dangerous of all allergic reactions. It is a kind of the reaction that involves whole or the entire body. It belongs to type 1 hypersensitivity reaction. So the main difference between the allergic reaction and anaphylactic reaction. So a normal allergic reaction that causes itching or probably a laryngeal edema is usually seen. But in case of anaphylactic reaction, it causes both, that is itching and also laryngeal edema, or in severe cases it may cause death of the person. So the causes of the anaphylaxis. Patients who have anaphylactic reactions because of some allergies, the body produces the proteins which can attack dangerous invaders, particularly the virus and the bacteria. Persons with allergies produce the immunoglobulins, particularly the IgE proteins, in response to harmless substances. So what these substances do? These substances trigger the WBC cells, particularly the mast cells, to release specific chemicals, most often histamines, to cause an allergic reaction. So the mechanism of the anaphylaxis. During the first contact, when the host that come in contact with the antigen, the circulating B lymphocytes get differentiated into IgE secreting plasma cells, nothing but IgE antibodies. These antibodies, IgE antibodies, they tightly bind to the Fc receptors that are present on the mast cells and also the basophils. So they get sensitized. During the second contact, the same process repeats. That is, when the host that come in contact with the antigen, the circulating B lymphocytes get converted into IgE secreting plasma cells, nothing but IgE antibodies. These IgE antibodies, they tightly or firmly bind to the Fc receptors that are present on the mast cells and also the basophils. Because of the tight attachment, so this causes the lysis of the cell. Because of the lysis of the cell, there is an influx of the sodium, calcium and also the water, and this degranulation takes place. Because of the release of the granules, there is a release of the inflammatory mediators. So the inflammatory mediators are serotonin, histamine, bradykinin, prostaglandins, some vasoactive intestinal polypeptides, some etc. This is the mechanism of the anaphylaxis. Common allergens may be insect stings, foods, particularly the peanuts, walnuts, shellfishes and eggs. Latex allergy, medications, particularly the penicillin, some anesthesia, and main medication is the aspirin. However, any substance, if the person is allergic, it can trigger an anaphylactic reaction. Okay, the signs and symptoms include skin reactions, including the hives and itching and flushed or the pale skin. There is low blood pressure, nothing but hypotension, constriction of the airways and swollen tongue or the throat, which causes wheezing and trouble breathing. There is a weak or the rapid pulse, nausea, vomiting or the diarrhea, dizziness or fainting of the patient is usually seen. So the signs and symptoms of anaphylaxis. Coming to the eye, there is a swelling of the conjunctiva. Coming to the nose, there is runny nose. There is swelling of the lips, throat and also the tongue. Coming to the severe, there is fast or slow heart rate. There is low blood pressure. Coming to the skin, there is hives, itching and flushing. Coming to the central nervous system, there is a light headache, loss of consciousness, confusion, headache and anxiety. Coming to the respiratory system, there is shortness of the breath, wheeziness or the stridor, hoarseness, pain while swallowing and cough. Coming to the GIT, there is a crampy abdominal pain, diarrhea and vomiting. Sometimes there is loss of bladder control and there is pelvic pain. These are the signs and symptoms of anaphylaxis. Anaphylactic shock, the treatment is an emergency and it is a rapid assessment. First is the airway. Look for and relieve airway obstruction. Call for help early. If there is any signs of obstruction, remove any traces of allergen if remaining. Give high flow oxygen using the mask with oxygen reservoir. Next, breathing. Look for and treat bronchospasm and signs of respiratory distress. Coming to the circulation, color, pulse and blood pressure should be checked. Coming to the disability, assess whether the patient is responding or not responding, whether the patient is conscious or unconscious. Coming to exposure, assess the skin with adequate exposure but avoid excess heat loss. Consider anaphylaxis whether there is compatible history of the rapid onset of severe allergic type of the reaction with respiratory difficulty and or hypotension, especially if there is a skin change if present. So the treatment of anaphylactic shock is the adrenaline and should be given in the IM route. For the adults, it is of 500 mg, that is 0.5 ml adrenaline injections of 1:1000. In pediatric patients, adrenaline is also the treatment of the choice, but it mainly depends upon the child's age and the weight. Further treatment includes antihistamines, particularly the chlorpheniramine is the drug, and the route is IM route, and the dose is 10 mg. Certain steroids like hydrocortisone is the drug, and the route is IV route, and the dose is 100 mg. And certain IV fluids also, the IV fluids can be given to the patient, but these will be administered by ambulance personnel if necessary. Thank you.